All right, well, hey everybody, it's Rebecca Gordon with Gordon Marketing here in beautiful Noblesville, Indiana. And you know what? We're about 3 months into health reform. We've seen a couple changes, right? We've seen a couple extensions. We've heard a couple speeches. I think we've heard a couple apologies. It's just been wild. If you're not in this market, take your hand and slap yourself. This is so exciting. And you can really capitalize on it, and we can help you capitalize. I want to talk about short term. So here's my little stick figure. This is you, this is your client, and they're saying, where do I fit in? Because there are a lot of options. The one option that the media talks is the marketplace. The marketplace is only for people who are going to get a subsidy. Your high earners should not go to the marketplace. They don't want the government having all their information. They should go to the private carriers. So my private carriers right now, you can write Anthem privately, you can write Assurant Health, and you can write Golden Rule, and you can check our website for which states they're writing private business in. It's still all ACA compliant. The plans are exactly like the plans in the marketplace, but you don't have all the nonsense, right? Like the website doesn't work, or how am I going to get billed, or how do I send these documents? On and on and on. So that's number one. Qualify your client. So your different options, one is going to be Medicaid. I don't know if you can see all this. Depending on your state has either expanded Medicaid to get more clients in it, or they didn't. We do nothing with Medicaid, all right? And so, you know, I would advise you don't do anything with Medicaid. You don't make any money on it. I have no background. I would send them to the Medicaid office, because if you go on to the Kaiser Family Foundation and if you look at their calculator, if your client makes too low, it won't give you a price. It'll say you're not eligible for a subsidy. Go to Medicaid. I mean, it won't give you anything. And so if that happens to you, it'd probably be a good idea to have a phone number, but that's where your client goes. This is option one. Option two, if we think our client is a lower earner, might be the breadwinner with gobs of kids, they need to go on exchange and get a subsidy, right? This is your sale price. And again, you can go to the Kaiser Family Foundation, you can look at the calculator. It's going to give you what I like to call a retail price, and it's going to tell you your sale price with the subsidy. But this, again, these are for folks who make in between like 130 and 400% of the federal poverty level. I'm terrible with percentages, so just check out the calculator and it'll give you a nice range. Here, private. So these are our big insurance companies who have been writing health insurance for maybe 100 years plus. These plans are identical, right? So they're all the 4 metal plans. It's all guaranteed issue. They all have the essential health benefits. But this one, you'll get a price break. This one you won't. Your high earners are going to fall into the private. So everybody is going to want health insurance, right? I'm sure if you polled every single American in the United States, they would say, yes, I want health insurance. Wanting it and being able to afford it are two different things. So if your client cannot afford the prices, your client might be able to qualify for a subsidy, but if the price is still so high, even with that sale price, if they can't afford it, they can't afford it. So then we have to have another option, and that option is short-term. I call this short-term to the rescue. Superman, big S. Short-term is major medical, and a lot of carriers are rushing into this space. We were waiting to see if Health and Human Services was going to allow short-term to be sold in 2014, and once they said yes, boom. Now, we've always been one of the largest writers of short-term, and I've always believed in short-term, but I've always looked at it as kind of a stepping stone, right, in between jobs, or maybe until you age into Medicare. But now we can totally rethink short-term because it is a major medical and it's comprehensive coverage. The things that short-term has, you're going to get a network. So you're going to get all the repricing discounts with the PPO. All your doctor visits, all your drugs count here. You can either buy a 6 or a 12-month plan. Now, I will tell you, Assurant Health has filed in all their states, 44 states, their 12-month plan. Some states have already been approved, some haven't. Check our website to see if your state has been approved. If it hasn't, no sweat, write the 6-month plan and then rewrite it. The big attractiveness here is price point. This will be 3 times at least more expensive than this, hands down. And you can go onto our site and quote short-term. But if your people can't afford this, they need an option. Now, what's the downfall? Well, one, it's not ACA compliant, so you will get a penalty. All right, what's the penalty? Well, the penalty is $95 or 1% of your taxable income, whichever is greater. So if we assume that your penalty is $95 a year, that breaks down to about $7. Pay it. I would rather pay $7, which for me would be 3 trips to Starbucks, and have a policy that is comprehensive rather than have no policy. So just be upfront with your client. If this isn't an option, we need an option. So it is not ACA compliant. I don't sweat that. That doesn't bother me at all. 2, it does not cover any pre-existing conditions. Short-term policies have never covered pre-existing conditions. So if your client takes cholesterol medication, we'll issue them, but they won't have any coverage for cholesterol. So that's something that you have to weigh and really look at what the condition is and how costly it is. You know, if I had a diabetic, I would probably discourage this. But you have to ask the questions. You need to tap into us if you're uncertain what questions to ask. But those are your 2 biggest downfalls. Now, I have several carriers that are in the short-term market. Some don't ask the decline question. Some do ask the decline question. So we can navigate that for you very easily. But this, I suspect we will see record sales in this. Because especially our young people with the new modified rating, young people cannot afford health insurance. Hands down. My 24-year-old nephew, who is perfectly fit, he's gorgeous. No possible way could he afford a health plan. Short term is going to be his option. Older people, anybody. The pricing here is going to drive people here. You need to make sure you are contracted with the carriers. There's no certification to do here. There's no timeline, right? It's not like you have to get it in. Your client should have coverage. And so you could write a lot of short terms today and have it issued tomorrow with an effective date. Call our office. Let us walk you through this. We have been living and breathing health reform for about 2 years. Tap into our expertise.